today we're going to be talking about the MonaLisa Touch. It's February and Valentine's Day is just around the corner, so we really want to talk about sexy time. But for some people, sexy time is not so sexy. And what this has to do with is their estrogen levels are coming down for various reasons, and now they're having pain vaginally. And so what brings that on? Well, it's any type of condition that's going to bring your estrogen down. That could be after childbirth. It could be you've had a hysterectomy, natural aging and the menopausal, course that we all go through. But also for breast cancer patients, there's a lot of hormone blockers that the women are taking. And this can be for someone even as young as 25 that is experiencing the same symptoms that a woman in her 40s or 50s is as well. And so what this is menopausal syndrome. And the symptoms that we see are dryness, vaginal itching and burning, painful sexual intercourse, a tightness in the vaginal canal, painful urination or frequent urination, and loss of bladder control in some cases. So what the MonaLisa is, it's a laser that is a fractional CO2 laser that treats the lining of the vaginal canal as well as the outside, and that helps restore those areas. So how does the MonaLisa work? Well, again, this is a fractional CO2 laser. And what it does is it beams light pulses into the tissue, and this has proprietary triple stacking as well. And what that means is that you're getting penetration deeper into the layers of the vaginal areas as well as the skin. We have these two probes. Now, the first probe is the internal probe, and you can see it's actually very thin. It's not as big as what you would think. You can see the difference between my thumb and the probe itself. So it's not that large, but what this does is this allows us to deliver that energy, and you can kind of see that we just rotate this around, and there's a little mirror that reflects the light onto the lining of the wall of the vaginal layer. Now, this is the probe for the external skin. This you can see we can put along the outside, and it controls the distance to there. And a fractionated CO2 is, if you've ever seen the game Connect 4 and you see all those little like checkers stacked, that's really what the pattern looks like. And it's about 10% of the area gets treated with these deep pulses, and then the other 90% is available to heal that area very quickly. And so that makes it heal fast, and you can get back to regular activities almost right away. And really the only downtime is no sex for just a couple of days. So the benefits of the MonaLisa laser are many. The first is really that this is a great procedure that's done here in the office. We don't have to go to the hospital, we don't have to have anesthesia, and it's virtually pain-free. We use a little bit of topical numbing on the outside for the skin, and actually inside vaginally, we really don't have any sensation, and so really just feels like a vibration. And as that probe is spinning, you just feel the vibration internally. So pretty much virtually pain-free. Now, again, there's no anesthesia, there's no downtime, and it actually only takes about 5 minutes to do the laser. So we'll have you come in for just a few minutes before. We'll put some topical numbing on, let you hang out and get numb for the external part, and then the treatment itself is only just a few minutes. Now, the thing that's really, really helpful for a lot of patients is it's hormone-free and chemical-free. So there are some patients who estrogen supplementation is really not right for them. This gives us another alternative to really help restore the vaginal lining in a hormone-free way. Now, like we talked about, the recovery is very, very fast. There's no downtime, so there's nothing that you can't do. The only thing we ask is just refrain from sex just for a couple of days afterwards until that vaginal lining recovers. And really, there's no side effects. So many folks ask me, while I'm doing all this, when am I going to see results? How long does it take to really notice a difference? Well, it's both immediate and long lasting. So typically the treatment is a course of 3 treatments, approximately 6 weeks apart. So on average, 18 weeks. There's some people who actually need an extra treatment or 2, but we'll make that determination on a very case-by-case basis, because on most cases everyone really has gotten to their best outcome by 3 treatments. You're going to see changes even as early as a week or 2, and you're going to feel some comfort, and really that area is beginning to change quite a bit, and you're going to see it over the course of that time. Patients have noted between the first treatment and the second treatment and the third treatment that they're noticing notable differences between each of those treatments, so it keeps getting better and better. It's clinically proven to work, and so our results are immediate, but they're also long-lasting. Now remember that the aging process and the estrogen process is not something that's set in stone. We're going to continue to age. Our hormone levels are going to continue to drop naturally, and again, if you're on hormone blockers, they're off for good. So you may need a touch-up. And what I encourage patients to do is really stay in tune with how their body is responding over time, even after their treatment. And if they start to feel like symptoms are coming back, well, then that's time to come in and have a single touch-up so that we keep you in that comfortable area and don't let things get back to the way they were. Most patients have described this as a game changer, and for many patients, they have really stepped out of the intimacy role in their relationship because it's so painful. And this has been really difficult for them and their partner. And adding this into their treatment regimen has made the world of difference, and so they're very happy with this. So if this sounds like something that's interesting to you, or you're struggling with any of these symptoms, give us a call, come in for a consultation. We're going to do an exam to make sure that this treatment is right for you, but then we'll get you scheduled right away so that you can get to feeling better. So take care and give us a call.